So with only 5% of physicians in the United States who are Hispanic, and the lack of targeted culturally relevant healthcare information, education, and outreach to Hispanics and patients alike, the intention of this forum is to awaken a conversation throughout Los Angeles, the San Gabriel Valley, and the country to strengthen the Hispanic talent pipeline in the healthcare and biomedical fields.
And you have to show them by example. We can do this. I can show you how to do it. I can show you how important it is to have an educated, healthy workforce, because these are the people who are going to care for you tomorrow.
And so our rationale is really the earlier the better. Multiple contexts, contact points to keep students engaged, authentic research experience and science experiences, which are much better and more motivating than facts, learning facts and figures. And then these high school internships are really proven to increase the chances that students will choose science and STEM careers and majors in college.
But there's got to be a model that you can follow. So what do I see? I see kids that fit that model of passion. I see kids that have hope about, not hope that we're talking about, it's a dream, it's actually comes to fruition. If we look at it, the hope is there, that there is a goal for them to accomplish. There is an agency, which is themselves. We support that agency, and there's a pathway that we can put together.
Of course, educational, but some of them have to be attitudinal. The broader society has to quit perceiving Hispanics and other minority groups with the deficiency model. Hispanics, we're not broken, don't try to fix us.
If you look at the community, it's about 5% of the hospitals that are real leaders, innovative, the Stephanies and Harlans of the world that are doing things that are particularly relevant for the Hispanic community. The second group of organizations, about 20% of the population, by the way, are quick to follow. And then the vast majority, about 75% of the population, are very slow to follow. So that's the industry we're in. What they look for, so that's, if you get beyond the innovators, that next tier, which we have to get to as quickly as possible, what they're looking at, what their questions they're asking are all about, show me success, show me where it's working, and they're also saying, show me visible leaders. So the visible leaders in the Hispanic community and visible leaders among healthcare leadership need to be out there talking about this topic and bringing solutions, quick successes.
Yeah, I think, once again, I think there are many, many opportunities, but I think all roles in the future require strong leadership skills. All roles require change agility. All roles require a greater sense of team play and interpersonal skills. So whether you're a scientist or clinician or a business administrative staff member, all roles require leadership, and all roles will require entrepreneurship. All roles require intellectual curiosity. The ability to work in a very dynamic and fluid environment is required by all, today and in the future.
So what Stephanie just told you is that we need more Hispanics in leadership roles, didn't she?
Right. It's really about making sure it doesn't just stop here, it starts here. And how we create that ongoing awareness is the first thing. The second piece is that there's a multidisciplinary approach to it. It's not any one group of individuals doing it. It's really looking across the spectrum of what we do in healthcare, whether it's our clinicians, whether it's our professionals on the business side of the equation, the communities we serve. It really, again, comes together working as one to make this change really not only happen, but sustainable. And I think the last piece is really, again, not losing sight of there are many, many themes today about, the teamwork, the collaboration, this notion that, again, working collectively, we can come up with innovative ideas if we simply look at things like peeking into that intellectual curiosity and looking at things like what's possible versus what's broken.
See, the bottom line is this. Failure to alleviate the tension points will immobilize future progress and the business of health if we don't collectively solve them together. You see, Hispanics in America are changing the business of health on multiple levels, and yet this is not being taken seriously enough. Because many executives and policymakers don't understand the tension points that they are unknowingly creating well enough to properly evaluate, invest, and act. Now, isn't this, at the end of the day, all about how to better serve the mission of saving lives?